What different types of procedures are there to treat gallbladder?
All right, so gallbladder disease can be treated basically 3 different ways.
Okay.
We talked about non-surgical, et cetera. There's a medicine called Actigol, brand name or whatever, but it's a chemical that breaks down the stones. It only works in a very small percentage of patients. It only works on very small stones, and it takes between 6 months and 2 years to work.
Wow.
So it's something we use sometimes in a very elderly patient, very sick patient, or for other reasons where we need to dissolve a stone and we're trying to buy time to do this. Now, that is not a common treatment. We have what's called lithotripsy. If you've seen patients with kidney stones, they might tell you they're having the kidney stones blasted or whatever. In gallbladder disease, in this country anyway, it's not FDA approved for that use, and it does have a number of problems because the stones fragment and then they go down the bigger tube into the pancreas and cause
And now you have a whole other issue.
You got a whole new problem. So finally, the treatment of choice, the gold standard, is surgery.
Okay.
And surgery basically is to remove the gallbladder via minimally invasive techniques, which is the current standard.
And you do this procedure robotically, correct?
The surgery can be done. So what is the robot? I guess that's the first question, because people always, they'll come with the glitz and glamour of, I want to have a robot. And the robot doesn't do anything. The robot
You're like,
does.
I'm doing it.
Yeah, we're doing the surgery. As you're seeing there, the person sitting at the side console is maneuvering the instruments, which are then being, it is laparoscopic surgery being translated by an additional piece of machinery, which is translating our movements. Now, not to say the robot has great use in certain types of surgery. I think we've seen, for example, in prostate surgery for urology and a lot of the advanced gynecologic procedures, it is absolutely the way to go. In general surgery, it's finding its place, especially in complex procedures. We do bariatric surgery in our group, for example, for obesity. And in that type of procedure, it has great use because it's a very complicated surgery. And the robot certainly allows you to do much more complex surgery more easily, basically because of the way it translates that information. There are areas of the body were very tight. We didn't talk about hiatal hernias. Hiatal hernias are hernias in the diaphragm. So instead of the stuff popping outward like you see the bulge outward, the bulge happens towards the chest, so you never see it. And oftentimes people have their stomach up behind their heart in the chest, and that will cause a lot of reflux and other symptoms, and that can be repaired, and that's a great operation for the robot.